Hi, my name's Matthew Links, and I'm the discipline lead for medicine at Bond University on the Gold Coast. And I'm coming to you from the land of the Kombumerri people who have been living and learning on this land for many thousands of years. So I'm very happy to have with us today Chrissy Antonopoulos, a part of our series on how to learn to be an inclusive practitioner. Hi, Chrissy.
Hi, Matthew. Thank you for having me.
Thanks for being here. Really interested to hear what you say about this topic. I might start by just asking you to tell us a bit about your story and how you came to be an advocate for diversity and inclusion.
So I have a disability myself. I'm legally blind. I was diagnosed when I was 24. So I still spent most of my life as a sighted person, and now I live with a disability. And prior to that, I had studied and I was working full time. And then once I got my diagnosis, I started to experience discrimination, wasn't hired, was told when I disclosed that I had a disability that I no longer had the job. So I started to experience all these things, and I wasn't sure what was happening then because I was very new to it. I went back to uni. I studied psychology. I'm almost a general registered psychologist, and I started my PhD a couple of years ago looking at implicit biases towards people with disabilities in the workplace. That was out of my own personal experience, but it was also from the discussions I was having within the community that it happens a lot. And it's not just employment, it's accessing services, it's within the healthcare system, it's, going to the shops. All these things were happening where there was discrimination. So I guess my experience led me to move into psychology and then to do the research. So it's really out of, my personal experience.
Well, can you tell us about your research? Because I love the idea of connecting personal experience to research. It really makes it real.
So, well, it makes it real, and it also gives you, as you know, PhDs take a long time, and you've kind of got to be really into your topic. So it's like a passion that you can see the purpose that it'll have at the end. So the first part I did a systematic review and meta-analysis on implicit bias towards people with disability. So that's just should be published any day now. We were just waiting for the link to come up. So that will be my first one published. And we found, so there's been about 20 years of research since a test was made that could measure implicit bias. So it uses associations and the time it takes when you associate different words and groups of people to measure the amount of bias we have. So implicit bias is, you might have heard of unconscious bias. So it's the biases that we all have where we prefer different things or different groups of people. And what's really interesting is with implicit bias, we're not aware consciously of it, but it can really impact our decision making. It can impact choices we make on a day-to-day basis, and it can be that real kind of automatic decisions we make. So it's has quite an impact on things like hiring, things like when we're seeing a patient and how we might treat them and the way we might diagnose. And there's a lot of research in that. So that's kind of what implicit bias is. So that was the first part. We looked at where it stands in terms of disability, and we found that there's a moderate negative implicit bias, which is quite strong, hasn't changed for 20 years. Doesn't look like it's going to change unless something drastic happens. The next part that I'm writing up at the moment was a qualitative study on looking at employers' perceptions of hiring disability. So I interviewed employers, some with disability, some without, and what they perceive as hiring, what are the barriers, what they think of people in the workplace with disability. And that was confronting, I guess, for me having the disability, and I didn't disclose to them prior to the interview, and often after I didn't as well, because there was some very awkward awkward for me, I guess, as having a disability, but things that were said. And a lot of it is in good, you know, in good faith, but there's these real like effects of what people are saying and doing in terms of including different types of people in the workplace. So that was that part. And then the next part will be looking at implicit bias and hiring behaviours. And we're not quite sure exactly how we'll do it yet, if we're going to do an intervention with it or whatnot, but that's kind of where I'm at with the research.
Wow, the employment's such a concrete illustration of the effect of implicit bias. But you know, I'm sure that, you know, we're healthcare professionals. We care about people. We deal with disability. Surely implicit bias is not something that affects me. I'm not biased.
But that's when, yeah, that's the thing when someone says I'm not biased. We're all biased. We all have biases. We need to acknowledge that. And I think what was interesting in the meta-analysis and the systematic review, it tended to be that the samples of healthcare professionals had greater bias. And you'd think, I know it's so counterintuitive, right?
Yeah.
And you think, oh, well, what's going on here? Like they should have experience, and it's something that's yet to be unpacked. I guess from personal experience in the psychology field, I found the field to be very biased, ableist. So I understand that people assume that when someone has a disability, they don't, you know, they're less capable or they can't do certain things, and there's all these things playing out. But it was really interesting to find, specifically with disability, that healthcare professionals tended to be more biased. There's also interesting about, in terms of healthcare professionals, decision making. So with implicit biases, this is more to do with so not just disability. There's research looking at cultural, racial implicit bias. And what has been found is that there's different decisions made based on the color of someone's skin. So they can tend to misdiagnose if someone is an Indigenous person. The communication's different. So if someone that has more bias will communicate differently, spend less time with the patient, might not answer as many questions. So there's all these little nuances that are really important when, you know, we're in a situation where we might be giving news that's quite confronting, and, you know, it's the time of someone's need, and things that we're not even aware of are changing the way that we communicate or changing the way that we interact.
Yeah, so you've really answered my question about why it's important for medical students to learn about their biases impacting on the quality of care, etc. How do you break down this idea that everyone else is biased, but I'm not?
I think the biggest thing is being able to reflect, and reflection is the start of noticing all our biases and all our preferences. And I guess it's, you know, when we say I'm not biased, we're probably the least aware of how biases work. So maybe it's not understanding that we're all going to have preferences, and that's okay, but it's being aware of it and making sure that it's not negatively impacting decisions in certain situations. So yeah, you'll probably hear me say it all the time, reflection, when it comes back to that.
Well, that's one of my favourite medical education things too, for all learning, really. It all starts with noticing, leads to reflecting. Do you think there are any particular skills that people need to learn in order to minimise their biases or be more inclusive practitioners?
I guess apart from reflecting, I think it's about being comfortable with exploring how you feel and being comfortable within your own emotions as well, because often we're not cognitively thinking, I don't like that person because they're different from me, or I feel uncomfortable because that person is blind and that scares me. So we're not having those thoughts, but there's something happening within our body that we're feeling something. And I think coming back to being really in tune with noticing what we're feeling. Okay, what is that? Being curious. Okay, I've noticed when I had this interaction, I felt tension. What is that? What is that telling me? So curiosity, being really in tune with your emotions and what's happening is really, you know, I think a really important skill for anybody and any profession, and just as a human.
Absolutely. I was one of the ways I diagnose patients as anxious is that they're making me feel anxious.
Yeah.
Being in tune with your feelings is really really helpful. So you're sort of talking about mindfulness in a way.
Yeah, it's that self-awareness, mindfulness, being in the moment, and not just in your surroundings, but within yourself. And you know, having that time, you know, to think about what is important to me, what am I comfortable with, what am I not comfortable with, and separate from working and studying, and just getting to know who you are, what are my values, what's important to me. Is there, you know, sometimes it might be that there's a difference in values between someone of a different culture, and being able to acknowledge that. And then once you know, then you can kind of be, okay, this is where the difference lies. How do I make a neutral decision moving forward?
Yep. It sounds like good advice. Okay, what about, let's say you're in a clinical placement, you know, you've got a patient with a disability, and you've got a chance to talk to them, to participate in their care. What would you advise a student to do in that situation to sort of learn to be a more inclusive practitioner?
I think a big thing is the different models we work in. So I don't know how much you learn about the medical model versus the social model. I don't know if that's something that's covered. It's not covered a lot in psychology either. But basically the medical model looks at the person's disability as an impairment, as a disorder, as something that needs to be fixed, and it's that condition that causes the disability. Whereas the social model, which is what most people with a disability and the wider kind of disability community look at it as, it's not the impairment or the condition that causes the disability, it's the environment around you. So it's the barriers that you face. And rather than focusing on the person, you look at what is in the environment. So what's making it more difficult for this person who might be more anxious, or who is in a wheelchair, or who's blind. And it's not so much the fact, you know, using my own example, that I can't see that makes me disabled. It's the fact that everything is provided visually. There's not, you know, text is really small. Like, it's all these things that actually make me disabled, rather than the fact that I can't see well. So I think thinking about it from that way, rather than how do I fix this person, it's about what does this person need to do what they want to do, or to communicate in the way that best suits them, or thinking of it in that way. So looking in the environment is helpful. And then also, again, being curious, asking questions. People will tell you, what do you need? Can you read this in this format, or how would you prefer me to, you know, communicate, or how would you prefer me to, do you want to have someone with you? Do you want me to write it down, or all those sorts of things? So providing options can be really helpful, and asking the questions.
I love that idea that it's not the solutions to lots of these problems is not, there's not an answer. It's the question. It's the being curious, being willing to open, being able to explore and find out what the answer in this one is, rather than having a list of answers that you've learned from textbook or something.
Yeah.
I love that.
I'm not giving answers.
Well, but you're giving a pathway to getting answers, and I think that's much more important. Okay. Now, can you give any examples then of times where you've seen people's attitude to people with disability change, where you've seen a transformation, where you've seen an experience that has really made them learn to look at the world in a different way?
Yeah, I think the most powerful thing is in-person, like personal experiences, I think that has been the most impactful, and like almost when you lead by example. So for me personally, when I get a lot of, I guess, pushback on, well, how do you do your job and how do you develop rapport? This is the things that people have said to me. How do you develop rapport if you can't see? Or how are you going to do psychometric testing? Or how are you going to pick up on nonverbal cues? And people just, they cannot understand, like coming into this, they were like, you can't be a psychologist. I got told not even to apply for a master's because we're not even going to take you because you're disabled. But then when you're in there and then people see you doing the work, and then they might ask, well, how did you do that? And I'll say to them and explain, well, this is how I adapted this particular test and this is how I did it and I'm competent in it. And it's that meaningful, I guess, interaction. So when people see it, they talk about it, you kind of lead by example, that's when things are shifting. I think that is the most powerful. And I guess practically, if somebody wanted to be more inclusive, it's about being aware of, you know, people's differences, or in going and engaging in ways that you can be exposed to different types of people and different circumstances in a meaningful way as well.
Sort of point about seeking out the experiences is potentially a vicious or a virtuous cycle. You avoid the person with a disability on the ward, you've got 20 people to see, and your implicit bias leads you to avoid them. You're never going to learn. So I guess you're encouraging, does that mean you're encouraging people to seek out those experiences? Seek out the person?
Even being more aware to that you're not avoiding it, or maybe it's like, well, I want to get to know more about this. Maybe I don't want to say like go and volunteer with a disability group and stuff like that, because sometimes it can be a little bit like, I don't know what the right word, it's a little bit icky in terms of like, oh, I want to learn more about this type of group, so I'm going to go and spend time. You want to make it meaningful. Is there someone you know? Is there something you're interested in? Is there someone that, you know, you might play sport that I've noticed I have a disability, I've never had a conversation with them. Maybe I'm going to be more present with that. Like finding really authentic ways rather than kind of, doing things that kind of make you feel good as well, if that makes sense. It's a bit more like paternalistic. That's a big thing that, you know, you don't want to do.
Yeah, fair enough. There's a long history of particularly Western interventions that fall into that category. One thing I was interested in is obviously the personal experience is the peak, etc. But is there? I'm interested in art and imagination. The the way that a movie or a novel, etc., can open your ideas and your mind to ideas that you have. And is there anything you'd recommend in that space that really can provoke people to think about where they're coming from?
I guess in terms of like any sort of media and art and reading books and that sort of thing, you want to go more for things that are written by people with a disability rather than about. And that's a really big thing at the moment, is like authentic representation. So you see, like, we can probably all think of a movie that just depicts a disabled character. That person didn't have a disability. And then often it's a stereotype. So we really want to look at those really authentic ones. And there's a lot being made now. There's TV shows and movies when if they've got someone who has cerebral palsy, they'll actually get an actor with cerebral palsy. So it's an authentic representation and it's, their experience. And so you can kind of learn to understand it through that as well. And the same with books. If you're reading a fiction that's written about a blind person and it's person isn't blind, doesn't know anyone who's blind, it can be quite stereotypical. So you want to kind of choose those the media that is written by people with disability, because then it's more of a genuine representation.
Yep. I hadn't thought about the the risks associated with that strategy of stereotyping. So if you had, one thing for my students to go out and do, what would the most important thing be for them?
Ooh, one thing, I guess, if you want to be aware of, if you're curious about, where are my biases, where do they sit, you can actually do the implicit association test, which is the most common one that we use to measure that. So you can go on, if you Google Project Implicit, they've got it all the different types there, and you can do them. You'll kind of get the hang of what they're measuring, how they're doing it. If you do like multiple, so maybe if you work with people of like a cold background often, or if you work with disability, or you think that your bias may lay there, maybe do that one first, because the more you do, you kind of get that practice effect. But that's a way that you can kind of look at it, and then it'll explain it to you, like what it means, what your score is, and then again, reflection and just thinking about where are my biases lie, and what do I want to, how do I want to work on that, and how may that be affecting my work. That's not one thing, is it? That's multiple things.
Yeah, but it's again, it's a pathway that starts with the one thing and leads you in a good direction. I guess the final question I wanted to ask was about the role of health practitioners as advocates. You've talked about you're an advocate, and the authenticity that comes from advocating for in a space that intimately. But what about health practitioners potentially can advocate for people with disabilities as well? What do you think the role is there?
I think it's important that we don't want to overpower someone else's voice. So even like I speak on my voice, someone else who might have the same condition as me might have a very different thing, and I want them to be able to speak for themselves as well. But obviously at times we can't, we're just stressed, or for whatever reason we don't want it, we need someone to advocate for us. So I think it's important when we really want to ask them, where do you want me to do, what do you want me to advocate, how do you want me to kind of to do this for you, so that we have those kind of understandings rather than assuming. I think again it comes back to asking questions. What can I do for you? How do you want me to support you in terms of advocating for whatever it might be? So collaborative, and asking those questions.
Yep. Well, that's been a whistle-stop tour of a whole lot of really important stuff and important work that you're doing. So congratulations on the work that you're doing, both in the research and in the advocacy sort of space. And I think there's a lot for our students to learn from what you've had to say. Any final words you want to leave them with?
Final words. I just think be curious and never assume, and no matter what happens, who is around you, just come from a place of curiosity, and you'll be very surprised at all the things you learn and discover.
Absolutely. Okay, thanks, Chrissy. Thanks everyone for your attention. Good luck, and may you have a more inclusive practice. Thank you.